Hello, my name is Russell, and in this video I'll be talking about bone dextrometry. Bone dextrometry is a specialty examination that measures the quality of bone. This exam uses X-rays to measure the content of bone mineral using a ratio of the projected area and calculated quantity it has in units of grams per centimeter squared. The bone dextrometry exam was developed by the National Osteoporosis Foundation in collaboration with other medical experts. According to the National Institute of Health, osteoporosis is a skeletal disorder characterized by compromised bone strength and predisposed to an increased risk of fractures. There are three main types of bone densitometers. The main one is the dual energy X-ray absorptiometry, or DEXA. Its primary function is to assess low bone mass using dual energy X-ray photons. It gives physicians accuracy and relative data of a patient's bone mineral density. With this data, they assess the individual's risk factors for fractures, response to therapies, or even perform vertebral fracture assessments. In order to understand how bone densitometry is used, technologists must have a basic understanding of bone composition. Bones are constantly going through metabolic changes. They store, absorb, and release essential vitamins and minerals that are detrimental to human homeostasis. Basically, there are main classifications of bones that we'll be discussing: cortical bone and trabecular bone. Simply put, cortical bone is the most compact bone found in the surface, which forms a type of shell. When there's trabecular bone makes up a greater surface but only accounts for 20% of the skeletal mass. Also, bones are composed of osteocytes, like osteoblasts and osteoclasts, which are living cells found inside of the bone. Osteoclasts remove bone, causing reabsorption, and osteoblasts build or replace bone tissue. Just like any radiograph, there are indications and contraindications for bone density exams. Some indications would be patient's age, gender, estrogen deficiency, irregular body habitus, and ethnicity. Also, pathological indications like hyperparathyroidism, rheumatoid arthritis, diabetes mellitus, and hypogonadism. Contraindications would be things like bone mass being too low to register, anatomic malformations such as scoliosis or kyphosis, and more importantly, if the patient is pregnant. There are three main types of bone densitometry examination machines. This one here is DEXA. DEXA is a dual energy X-ray photon that creates photons in a pulsing frequency. Beginning with a scout image and scans specific areas of interest, it analyzes it and then produces a bone mineral report. This report includes the patient's data compared to other bases of bone densitometry to determine a certain diagnosis. This here is quantitative computed tomography, also known as the QCT. It is a type of CT scan that allows the calibration of grayscale and uses special software that allows for cortical bone and trabecular markings to be visualized on a 3D image. Compared to DEXA, the QCT has a higher cost and also gives the patient a much higher dose. Quantitative ultrasound, also known as QUS, is a non-ionizing technique that uses ultrasound to measure bone density. It allows patients of excessive weight which may not be able to use DEXA to be scanned. This uses ultrasonic wave velocity and attenuation to demonstrate bone density. This usually is done where there is minimal tissue such as the patient's heel. Since this is a non-ionizing technique, this may eventually replace DEXA and QCT when this technology becomes much more advanced. The positioning of the patient is crucial for these exams. For example, the spine or lumbar spine should be consisting of L1 through L5 and should be scanned depending on your departmental protocol. For positioning of the patient, you place them supine with the mid-sagittal plane midline of the table. The projection will be AP and the CR will be at iliac crest. The next and very common positioning would be for the hip. For the hip, the acetabulum and proximal femur must be included. The patient is supine with the mid-sagittal plane aligned on the table. There's rotation of the leg inward 15 to 20 degrees depending on the patient's anatomy, and the patient must not move with an AP projection demonstrating the hip, acetabulum, and neck of the femur. Another body part used for this examination would be the forearm. For the positioning, the wrist and the forearm will be positioned laterally, rotated slightly backwards for a true lateral position, or placed with a PA projection with the hand and wrist facing downward. There are two ways to compare bone density measurements, and this is one way known as the T-score. It compares the patient with average scores of other healthy individuals and without using their population standard. Having this score slightly under or over the average would still be considered a normal outcome. These exams can range from good bone density, normal bone density, osteopenia, osteoporosis, and severe osteoporosis. Another different type of scoring would be known as the Z-score. The Z-score is used when you know the population standard deviation of that patient. It calculates the average knowing the peak bone density for that average and how greatly the population of a certain age and sex or ethnicity deviates from that average.